Exactly 1 month after receiving a new bivalent booster, Dr. Rochelle Walensky, the director for the CDC, has tested positive for COVID-19. I think this is important to sort of pause and talk about a little bit because Dr. Walensky herself has repeatedly said verbatim, these breakthrough cases are incredibly rare, numerous times on legacy media outlets, which has caused people to be convinced that they're bulletproof, which has caused division amongst family members, amongst employees and their employers. This has caused small businesses to require people, their employees, to get vaccinated or patrons to get vaccinated. This has prevented travel in different countries. This idea has also created division amongst kids and peer groups, and even on sports teams in the Olympics. You know, if you didn't get the booster, you couldn't go to the Olympic trials. These are the healthiest people amongst us. We, of course, have many high-profile athletes in our society that you know about that have been prevented from participating in sport for not buying into the medical coercion that has been foisted upon us. And it's interesting, now we have the director for the CDC, again, exactly 30 days after receiving a new bivalent booster. Presumably she had the primary series plus 2 boosters, and then now the 5th cumulative shot, and she has tested positive, okay? We also have the president of Pfizer himself. I'm just giving you, data just in case you don't know. He has tested positive on 2 separate occasions for COVID. We have, of course, Anthony Fauci. Okay, we have Joe Biden, right? We have many high-profile political figures. Justin Trudeau, for example. So these breakthrough cases are not incredibly rare. They're actually quite common, contrary to what we were promised over the course of the last year and a half. And again, I point this out because society has focused so much on the pathogen and these external measures that we can take to so-called prevent infection, but we haven't been focusing on health. We haven't talked about exercise. We haven't talked about vitamin D. We haven't talked about eating a unprocessed whole food rich diet. We haven't talked about sauna therapy. So why are we focusing so much on these external factors that have been shown to not be as effective as they were promised, while we simultaneously ignore the very things that we should and could be doing as people, as individuals? We should be encouraging exercise. We should be incentivizing real food. We should be promoting vitamin D. We should be talking about all these things, but we're not. And yet here we have multiple instances of breakthrough case after breakthrough case in these people that told you that if you get the shot, it's your social, we have to do it for the social good. This is how you save your grandmother, right? If you get the shot, you can't transmit the virus to someone else. But all of these people now, multiple of them, are testing positive. These breakthrough cases are not that rare. So I think what we need to be focusing on is our own immune systems, my friends. It is the host. The host is everything. So winter is coming. Pathogens are surging. The days are getting shorter. Your cutaneous synthesis of vitamin D is being diminished if you live north of Atlanta, Georgia. So we got to focus on vitamin D. We got to focus on exercise, whole food nutrition, all of those things. Why are we not hearing about that? That's my main message. Again, we have created so much division. People are announcing their vaccination status on their social media profiles, on their dating profiles, on their email signatures. Where is the same level of exuberance and excitement for exercise, for nutrition, for whole food, for all of the things that actually improve immunologic health? Okay, that's what, if we're serious about reducing disease severity, Roxy's joining the conversation here. If we're serious about reducing disease severity and hospitalizations and concerned about ICU capacity, then we should be very serious about all the things that I just mentioned. Nutrition, sleep, stress reduction, micronutrients, all of those things. We shouldn't just be, myopically focused on coercing as many people as possible to get shot after shot after shot without fully knowing the long-term implications of that, my friend. So hopefully you feel the same way that I do. I'm sure you do. And again, we have many shirts that can influence, hopefully, people in your community, your friends and your family, and your workplace to make healthy living the main thing. Let's major in the majors, not major in the minors, right? So I'll put links to shirts like this in the description. Have a great rest of your Saturday. We'll catch you all later. Bye now.